So what I did with this, because we had minimal number of grafts to work with and we wanted to give a natural design and kind of frame the face, I created the temporal peaks here to give us shape this way in the vertical plane. And by doing that, it helps break up the face, not only in the horizontal plane with the aesthetic thirds, but it brings it in and narrows the face. As we age, the face comes triangular, and this brings it back in. And then what I did was I created a frontal tuft with a hairline that connected in the sides. And so essentially I said, what happens when you lose your hair? The first thing to go is the crown. And we left the crown for right now. And then what happens is you gain these alleys. Then the frontal hairline moves back and just kind of leaves you a little bit of a tuft here. So what we're doing is trying to take that in reverse. So we leave the crown, because that would look like a natural thinning pattern, and we start to give the most density in this frontal tuft here. So that's what we did in this zone. But we wanted to connect a receding hairline, so that's what we did here, and we wanted to give it a little bit of density in these alleys so that it didn't, so that it blended into the area here, which you see here. And then what we did was we filled that in a little bit, and then instead of this just being a hard line of really dense hair, we feathered it in the back too, almost like we were creating a hairline. And so this gives us a very natural look. And then we can do a second session, actually, because even despite what we're taking out over 2,500 grafts, you can't even tell that I actually removed anything. We can go in here and either increase the density in here or actually start to feather in a whorl pattern in the crown as well. And so we'll let the patient choose with what we want to do. We'll also do medical therapy with topical and oral medication and some stem cells to help stimulate some of the miniaturizing hair in here and try to bring this area in so we have less grafts that we need to do. And then, that will help give us a more natural look as well. And we can also consider scalp micropigmentation to go in between these areas to give us the appearance of more density. It blocks the light from shining through. So that's the plan, and it gives us a very nice natural result. It changes the face and how it looks with a small number of grafts.